Hello and welcome. My name is Julie Lyons, and I'm the Region 4 representative for Well Ahead, Louisiana. I'm so happy you joined Wise Woman and taken this important step towards healthy lifestyle changes. As part of this no-cost program, you will have access to resources, trainings, and community support. This is week 1 of the 6-week Living Well Ahead series with health lessons created by the American Heart Association. This series will help you learn the ins and outs of blood pressure, diabetes, and how to make healthy habits part of your lifestyle. But before we get started, I want to tell you a little more about this series and how you can get the most out of it. We encourage you to watch one series video each week. After watching each lesson, take what you have learned and put it into practice for the rest of that week. This will help you build healthy habits into your daily routine. Each lesson takes about 30 minutes to watch. Watch when convenient and try to minimize distractions. When a discussion question is asked, pause the video and take time to think about your answer. Your Wise Woman health coach will follow up with you regularly for support. Let's get started. Our week 1 lesson is Control Your Blood Pressure. The information in this health lesson will be helpful for anyone who may be at risk for high blood pressure, have high blood pressure, know someone with high blood pressure, or care for someone with high blood pressure. The Control Your Blood Pressure health lesson is part of the Empowered to Serve movement, inspired and created by the American Heart Association. This lesson will focus on 3 topics. First, how you can prevent and manage high blood pressure. Second, how high blood pressure can hurt your body. And third, how blood pressure control can empower you and those around you to take care of your health. Throughout the lesson, you will notice high blood pressure abbreviated HBP and also referred to as hypertension. All of these terms refer to blood pressure. Let's talk a little more about Empowered to Serve. Empowered to Serve is a movement inspiring those who are passionate about driving change through health justice in their communities. This means that you can be an example for your family, friends, and even your community by learning about blood pressure and diabetes, practicing healthy habits, and sharing what you know with those around you. This Living Well Ahead series is a great way to do just that. Let's take some time to learn specifically about blood pressure. Did you know that nearly half of American adults have high blood pressure and many don't even know they have it? Do you know someone with high blood pressure? The best way to know if you have high blood pressure is to check your blood pressure regularly. You can even measure your blood pressure at home by using an automatic blood pressure cuff, like the one you see over in the picture. If you don't have an automatic blood pressure cuff at your house, ask your Wise Woman health coach, and she can help you get a cuff to use at home while you are participating in the Wise Woman program. High blood pressure affects people in multicultural communities at a higher rate. Let's look at the slide to see how much multicultural communities are affected. Over 1 in 2 African Americans, over 1 in 3 Asians and Pacific Islanders, over 1 in 3 Hispanics and Latinos, over 1 in 4 American Indians and Alaska Natives are negatively affected by high blood pressure. It is important to remember that heart disease, high blood pressure, stroke, and obesity are very serious diseases that can impact our lives. We want to share with you what you learned today with your family and friends. You can even have them watch this video with you so you can learn together. The rest of the Control Your Blood Pressure health lesson will give you information about blood pressure in the normal range for blood pressure numbers, how high blood pressure can impact your health, and things you can do to help control your blood pressure. So let's define high blood pressure. When your heart beats, it pumps blood into your blood vessels, which creates pressure against the blood vessel walls. This blood pressure causes your blood to flow to all parts of your body. High blood pressure is when your blood pressure is consistently too high. So what do the numbers mean? Your blood pressure has two numbers. There is a top number and a bottom number that make up your blood pressure reading. The top number is called your systolic pressure. This number tells us the pressure of your blood against your artery walls when your heart beats. Take a look at the picture of the blood pressure monitor on your screen. The systolic pressure, the top number, is 110. The bottom number is your diastolic pressure. This number tells us the pressure of blood against your artery walls where your heart is resting between heartbeats. In the picture, the diastolic pressure, or the bottom number, is 67. Let's look at the healthy and unhealthy blood pressure ranges as recognized by the American Heart Association. Normal or healthy blood pressure, highlighted in green, is a reading below 120/80. An elevated blood pressure, as highlighted in bright yellow, is a reading with a systolic between 120, 129, and a diastolic less than 80. High blood pressure, hypertension stage 1, highlighted in gold, is a reading with a systolic between 130 and 139, or a diastolic between 80 and 89. High blood pressure, hypertension stage 2, highlighted in burnt orange, is a reading with a systolic 140 or higher, or a diastolic 90 or higher. And hypertensive crisis, highlighted in dark red, is a reading where your systolic is higher than 180 and or the diastolic is higher than 120. If you get a reading that is 180/120, contact your healthcare provider immediately. Preventing and managing high blood pressure are key. If your blood pressure is normal, less than 120 systolic, the top number, and less than 80 the diastolic, that bottom number, it should be screened during regular healthcare visits at least once per year for anyone 20 years of age or older. Knowing about your blood pressure and how to keep it within a healthy range can help you manage and prevent high blood pressure. If you are diagnosed with high blood pressure, your doctor may have you do the following. Monitor your blood pressure numbers at home in addition to your regular healthcare visits, and follow a treatment plan that includes lifestyle changes and, if needed, prescription medication. So high blood pressure puts you at greater risk for developing life-changing and potentially life-threatening conditions. Most of the time, there are no obvious symptoms. Certain physical traits and lifestyle choices can put you at greater risk for high blood pressure. When left untreated, the damage that high blood pressure does to your circulatory system can put you at much higher risk for heart attack, stroke, and other health threats. Do you remember the two numbers you need to know when measuring your blood pressure? Of course, the top number is systolic, which is the pressure in the arteries when the heart pumps, and the bottom, diastolic, the pressure in the arteries when the heart relaxes between beats. In most cases, the damage done by high blood pressure takes place over time. Did you know? When your blood pressure is too high for too long, it damages your blood vessels and can lead to atherosclerosis, which are fatty deposits that build up and clog your arteries. This increases the workload of your circulatory system while decreasing its efficiency. So let's look at some of the consequences of high blood pressure. Stroke, vision loss, heart failure, heart attack, kidney disease, kidney failure, sexual dysfunction. It is important to remember that high blood pressure can have deadly health consequences if not treated. This is why knowing your blood pressure is so important. So when your blood pressure is 130/80 or higher, you are considered high risk. When your systolic number is between 130, 139, and your diastolic number is between 80 and 89, this is hypertension stage 1. At this stage, your doctor is likely to prescribe lifestyle changes and may consider adding blood pressure medication based on your risk of heart attack or stroke. When your systolic number is higher than 140 and your diastolic number is higher than 90, this is hypertension stage 2. At this stage, your doctor is likely to prescribe a combination of blood pressure medication and lifestyle changes. If you remember back to one of the first slides, you learned that nearly half of American adults have high blood pressure, and many don't even know they have it. It is important to follow the treatment plan that your healthcare provider recommends for you. So, take what you've learned so far, and let's answer 2 questions. First, can you have high blood pressure and not know it? Yes. Second, what are some of the risks of uncontrolled high blood pressure as we discussed earlier? So think back: heart attack, heart failure, stroke, kidney failure, eye damage, and even death. So a number of factors and variables can put you at greater risk for developing high blood pressure. Some of these are out of your control and are known as non-modifiable risk factors. For instance, family history. If your parents or other close blood relatives have high blood pressure, there is an increased chance that you'll get it too. Increased age. The older you are, the more likely you are to get high blood pressure. Gender. Until age 64, men are more likely to get high blood pressure than women. But at age 65 and older, women are more likely to get high blood pressure. Race. As we discussed earlier, African Americans tend to develop high blood pressure more often than people of any other racial background in the United States. It also tends to be more severe, and some medications are less effective in treating high blood pressure in African Americans. And chronic kidney disease. High blood pressure may occur as a result of kidney disease, and having high blood pressure may also cause further kidney damage. There are other risk factors for developing high blood pressure referred to as modifiable risk factors. These are known as modifiable because you have the power to modify, to make the changes. Modifiable risk factors include lack of physical activity, unhealthy diet, especially when high in sodium and cholesterol, being overweight or obese, drinking too much alcohol, having high cholesterol or diabetes, smoking and/or tobacco use, having high levels of stress. The important thing to remember about modifiable risk factors is that these are the things that you can change. And when you work to change these factors in a positive way, you decrease your risk for high blood pressure. So let's look at ways to manage your blood pressure and keep it in check. Let's start by not smoking, not vaping or using tobacco products, eating a heart-healthy diet, reaching and maintaining a healthy weight, getting regular physical activity. Limit your sodium, your salt intake, limiting how much alcohol you drink, your alcohol intake, taking your medications properly as directed. Take these small steps to big changes. Just try starting with 1 or 2. So, to enjoy the benefits of better health and reach your goals, work with your doctor or healthcare provider. Remember, if your blood pressure reads at or above 130/80, you will probably be prescribed blood pressure medication. You may need more than one type of prescription medication, and you may need to take it every day, maybe for the rest of your life. It's also important to be aware of how some over-the-counter medications, like decongestants, may affect your blood pressure. If you have high blood pressure, home monitoring can help your healthcare provider determine whether treatments are working. As part of the Wise Woman program, you may be able to receive an automatic blood pressure cuff to use at home. Talk with your Wise Woman health coach to learn how you can get an automatic blood pressure cuff to measure your blood pressure at home while on the program. Using your automatic blood pressure cuff correctly is very important to make sure you are getting accurate readings at home. Your Wise Woman health coach will teach you the proper technique for measuring your blood pressure. There is a blood pressure measurement instruction resource on the Wise Woman webpage. This resource is a great reminder of how to get an accurate reading from home. In order to get correct blood pressure readings, it's important to follow these instructions. Also, provided is a printed chart for you to log your blood pressure readings, or you can use American Heart Association's online check.change.control.tracker at heart.org/CCC. By working with your healthcare provider and making lifestyle changes, you can control your blood pressure. To learn more about high blood pressure and what you can do about it, visit heart.org/HBP. I will also share some additional Wise Woman resources at the end of this health lesson for you to learn more. Now, as this lesson comes to an end, we want to call you to action to control your blood pressure. You can keep your blood pressure in check. Let's look at some ways. Lowering your sodium, your salt intake, by reducing the salty foods you eat, getting active and increasing physical activity, drinking alcohol in moderation, if you even drink at all, reduce your weight, and of course, eat better. By keeping your blood pressure in check, you will empower yourself as you control your blood pressure. Thank you for joining today. Remember that your voice matters, and please share the information you learned today with your family and friends. Encourage everyone to be active in the Empowered to Serve movement. You can help us work to draw communities together on the path to building sustainable culture of health. Encourage your family and friends to listen to the Living Well Ahead Health Series health lessons with you. We appreciate your thoughts. If you would like to provide the American Heart Association with any feedback about the Control Your Blood Pressure health lesson, you can send an email to empoweredtoserve@heart.org. Be sure to check out these resources to support you on your journey. Visit www.wellaheadla.com/wisewoman for links to all available resources. Visit the Well Ahead Community Resource Guide at www.wellaheadla.com/CRG to search for support services near you. And join the Wise Women Facebook group to receive tips and encouragement from others taking this journey with you. Or use this QR code to join the group today. So great job. You have just completed week one of the Living Well Ahead series. We are so proud of you. Over the next week, pick one or two things that you think you can do consistently and put them into practice. Remember, small changes over time can make a really big difference. We will see you next week for week 2 of the Living Well Ahead series called Break Up with Sodium. During this lesson, we will learn more about what sodium is and how it affects your blood pressure. See you then.